today's video, we will talk about Alzheimer's disease, a chronic degenerative brain disease that is the most common cause of dementia. The main clinical manifestation of Alzheimer's disease is memory impairment, as many brain functions are affected, and thus the social life of the patient is seriously affected. Alzheimer's disease is not related to normal aging and functional brain decline. However, the older you get, the more likely you are to get the disease. From the 7th century BC, in the time of the ancient Greek philosopher and mathematician Pythagoras, such cases had been recorded and reported. The study of the history of medicine shows us many times that a new approach to an existing observation and recording, but also deep study and innovative practice, lead to discovery and knowledge, confirming the saying of Hippocrates, to think something only without acting is considered a sign of ignorance, that is, ignorance of the art of the doctor. However, it took 106 years since Dr. Alois Alzheimer first identified the degenerative neurological disease that would deprive thousands of people around the world of life and decent survival, to pinpoint its origins. Alois Alzheimer was born on June 14, 1864, in Bavaria, Germany, son of the local notary of the small town. Nothing is known about his childhood, except that he attended a number of German educational institutions and received his degree in medicine from the University of Würzburg in 1887. Later, he specialized in psychiatry and developed a deep interest in neuropathology, the study of brain degenerative diseases, with the help of the microscope. A defining moment in his life and in science would be in 1901. A 51-year-old patient, Auguste Deter, who was admitted to the Frankfurt Mental Hospital due to a progressive mental retardation, focal symptoms, hallucinations, and psychosocial disability. The patient was studied for 5 years by Alois Alzheimer. Prior to her death on April 8, 1906, her medical records and brain were transported to Munich to the Royal Psychiatric Hospital of Alzheimer's mentor, the famous German psychiatrist of the time, Emil Kraepelin, where Alzheimer worked in the lab of anatomy. After the death of Auguste Deter, Alzheimer performed an autopsy on her brain, where with the help of Italian physicians Gaetano Pericini and Francesco Bonfiglio, using new silver staining techniques by Max Belchowski, found unusual features such as intertwined nerve fibers, as well as what is now known as amyloid plaques. In 1907, Alois Alzheimer published a brief description of the woman's symptoms. In particular, he referred to the intense jealousy that Auguste Deter showed towards her husband. This was followed by short-term memory loss. She lost her focus even in her own home. She also had delusions, acoustic hallucinations, and was temporarily delusional. An autopsy revealed that she generally had an atrophic brain without microscopic lesions. Alzheimer announced his findings on pathological brain degeneration and the symptoms of premature dementia in November 1906 in Tübingen at a meeting of psychiatrists in southwestern Germany. Unfortunately, his lecture passed indifferent to his colleagues without accepting any questions or comments about his discovery of the pathological features of a type of senile dementia. After his lecture, Alzheimer published a summary of his findings, while in 1907 he wrote an extensive work which presented the disease and his findings in detail. In mid-December 1915, Alzheimer fell ill on the train to the University of Breslau, where he had been a professor of psychiatry since 1912. He probably had a streptococcal infection with rheumatoid fever and kidney failure. He died of a heart attack at the age of 51 in Breslau. The German neurologist indication came in 1997 when a team of researchers under the guidance of Professor Manuel Greber at the University of Munich found the lost nearly 200 slides of the patient's brain prepared by Dr. Alzheimer. The slides were studied and it was confirmed that the patient was actually suffering from Alzheimer's and not some other form of dementia, as she had a very large number of amyloid plaques and neurofibrillary tangles in her brain, which increase in number as the disease progresses. In terms of treatment, the first patients with Alzheimer's disease did not receive any treatment. Alzheimer's disease, or memory loss in particular, was a process that was thought to be inevitable in every individual. According to pioneering gerontologist and speech pathologist Joan Glickstein, who devoted much of her life to caring for Alzheimer's disease, this torturous disease is one of the main forms of dementia characterized by loss of memory, acquired mental deficit, and persistence. But let's see nowadays how does Alzheimer's disease is defined in modern medical reality. Today, the term Alzheimer's disease is mainly used indiscriminately as a synonym for Alzheimer's dementia to identify abnormal brain aging, or mild, or to denote cases of true Alzheimer's disease. Firstly, we know that the disease appears with memory loss, which is the main feature of Alzheimer's. There is difficulty in abstract thinking, for example, in calculations with numbers, as well as difficulty in speech, in the sense of finding the right word. The lack of orientation, for example, the patient can lose the way to their house, and so on, is an additional negative effect of the disease. Patients also have difficulty judging and making decisions, so the patient cannot solve simple everyday problems such as what to do when the food burns in the kitchen. There is also difficulty in performing daily activities and developmental disorders such as depression, anxiety, and aggression. What is clear is that the onset of the disease has not just one cause but a network of causes: genetic, environmental, and lifestyle. Regarding the biochemical substrate, it has been found that certain proteins, such as beta amyloid and protein T, are associated with nerve cell degeneration and death, and this is the focus of modern research and the drugs used. Over time, and as studies on Alzheimer's disease increase, the complications caused by the disease in patients with a predominant social withdrawal are observed and recorded. Social withdrawal affects both the patient and their environment, as in advanced stages of the disease, the patient does not recognize his family and home and puts himself in danger. Also, there is often weakness in feeding, difficulty in swallowing, aspiration, and falling on the ground, resulting in head injuries, hip fractures, and so on. In advanced stages, in fact, the patient is bedridden and cannot self serve. When signs of Alzheimer's disease are suspected, the patient should consult a specialist neurologist as soon as possible. The diagnosis of Alzheimer's disease at an early stage is possible and allows the application of many interventions, medicinal or not. After a series of procedural examinations, after taking the patient's history, neurological examination, neuropsychological tests, blood tests to rule out other simple causes of dementia such as hypothyroidism, vitamin deficiency, and so on, researchers use MRI or CAT scan of the brain as well as PET scan to study and analyze the anatomical structures and neurophysiological functions that cause degeneration due to Alzheimer's disease. In terms of treatment, Alzheimer's disease is not curable, but it can be treated and its progression can be slowed down, both with medications such as cholinesterase inhibitors and memedin, as well with music therapy. The most common form of dementia is Alzheimer's disease. Other types of dementia include vascular dementia, Lewy body dementia, and frontotemporal dementia. Medication is necessarily supplemented with significant changes in the patient's daily lifestyle. The patient should have a diet rich in fruits and vegetables, olive oil, whole grain bread, and so on. Physical exercise as much as possible, for example, walk every day. Mental exercise with activities such as reading, painting, and crossword puzzles. Organize his way of life, for example, write down his medicines and strictly follow his daily routine. Participate actively as much as possible in the family life by taking on roles, even insignificant ones. For example, avoid sitting all day in front of the TV. Instead, help with cooking, tidying up the house, and so on. Since 1911, the disease has been used by European physicians to diagnose patients in the United States. Today, research in neurology, psychiatry, and the neuroscience in general has shown that Alzheimer's disease is characterized by reduced brain activity, brain atrophy, neuronal death, neurofibrillary tangles, and overall reduced cognitive ability. Genetics play a key role in the cause of the disease, with findings suggesting that mutations on chromosomes 21, 14, and 1 may lead to Alzheimer's disease, and that people who carry a gene for apolipoprotein E4 are at significantly higher risk to develop Alzheimer's disease compared to people who carry genes for other forms of the protein. Due to the disease, many people with dementia end up living isolated at home without being able to move anymore, making their care even more difficult. The COVID 19 pandemic made things worse for people with dementia and their families. Every 68 seconds, a new case of Alzheimer's disease is diagnosed worldwide, while according to the latest epidemiological data, during 2021, it is estimated that there will be a total of over 9.9 million new cases of dementia. If you also want to be part of a wider scope to inform and interact with professionals worldwide and exchange views and experiences in matters relating to the challenges of dementia and other neurological diseases, as also handling suggestions, just subscribe, click like, and hit the bell to become part of a wider community with an excellent purpose.